Hi, everyone. Good morning. It's a great pleasure for me to be here with all of you to talk about the role of emphysema in long-term prediction. And I will talk about this issue through the results of our last publication in radiology. So you are radiologists. I don't have to explain to you what is emphysema. But just for a little bit of introduction, you know that the gold standard to determine the presence of emphysema is chest CT, as well its severity and the different subtypes that are centrilobular, paraseptal, and panlobular. Emphysema is highly prevalent in lung cancer screening cohorts, and up to 35% of patients will present emphysema and a baseline low-dose chest CT, and is even higher with a higher risk profile of the patients. You already know also that the presence of emphysema is related to a higher risk of presenting lung cancer and COPD, as well as their mortality, but also is related to other comorbidities also seen in the chest CT, such as osteoporosis, coronary artery calcification, and even muscle loss determined by chest CT. There's two ways to determine the presence and the severity of emphysema. By one hand, we have automated by software or through artificial intelligence algorithm. Obviously, this technique is more objective, but it also has more variability in acquisition and reconstruction, as well more noise sensitivity, and this is really important in low dose settings. And it also has a lack of standardization that is also very important in multicentric studies such as I-ELCAP. And nowadays is limit for identifying the different subtypes that I mentioned before. By the other hand, we have the visual detection, that is the eye of the reader of the chest CT, as could be a radiologist or a pulmonologist. Is obviously more subjective than the other one, but some studies found better correlation with pulmonary function tests in comparison with the automated by software. And as you don't need any sophisticated tool or any software, is still the gold standard in the clinical daily practice. The role of emphysema as a mortality predictor in low-dose chest CT has been already assessed by small cohorts such as this that I bring to you, the Italang screening trial with 524 participants followed by 13 years with 81 deaths, and they found that the emphysema determined by software at baseline has an overall mortality and cardiovascular mortality, high overall and cardiovascular mortality, as you can see here with the odds ratio between 2.22 and 3.66. Importantly, machine learning analysis showed that the most important variable, especially in overall and cardiovascular mortality, was this emphysema at baseline. And as you can see here, the area under the curves are good, but could be improved. So as we are in the era of preventive medicine, what if just by looking your patient's first low-dose chest CT, we could already predict long-term mortality from the three major causes of death worldwide? This is the question behind our study. This question was firstly assessed by I-ELCAP, recruiting 9,000 asymptomatic lung cancer screening participants in June 2020. And they found that a simple visual baseline emphysema score ranging from 0, non-emphysema, to 3, severe emphysema, was a strongly predictor of short-term mortality from both COPD and lung cancer. Our question was simple. In this same population, but follow up to 25 years, does the same visual emphysema score continue to predict not only mortality from COPD, but also cardiovascular and all-cause mortality? So let's go straight to the results. These 9,000 asymptomatic lung cancer screening participants, 51% were female, with a median age of 65 years and a smoking history of 43 pack years. They have 29% of them had emphysema at baseline, mostly mild, followed by moderate and severe. And with a median follow-up of 23.3 years, we found a total of 3,738 deaths, 3.3% from COPD and 12.7% from cardiovascular diseases. So let's go to the key findings of the study. This baseline visual emphysema score was a strong predictor of long-term mortality, of all-cause mortality, as you can see here with the Kaplan-Meier survival curves. And you can see here of the emphysema categories, you have none, mild, moderate, and severe, and you can see also dose-response relationship. And importantly, the adjusted analysis by sex, age, pack years, and time since quit also confirm this association. We saw a similar pattern of COPD between emphysema at baseline and COPD mortality and long-term. And as you can see here, we observe also this dose-response relationship. The greater the emphysema severity was, the higher the risk of mortality and long-term from COPD. And also the adjusted analysis showed statistically significance and an odds ratio of 3.29. Finally, this is important because we also see a link between the emphysema at baseline and long-term mortality from cardiovascular diseases. However, the dose-response relationship here was less clear, as you can see here, but the analysis were also statistically significant with a 14% of increased risk of mortality, cardiovascular mortality. So as a conclusion, we can say that a simple visual emphysema score at baseline, no artificial intelligence needed, no software needed, is a strong predictor of long-term mortality from all causes, cardiovascular and COPD mortality. This highlights the idea of the integration of heart and lung screening, and this may help to implement early prevention strategies in the future. Thank you very much, and I will be happy to answer your questions.